The Foundation for Medical Practice Education, the FMPE, came out of some work that was done in the 80s by a physician at McMaster University. And he had tried out some new ways of presenting continuing medical education for family doctors. What he did is he wanted people not to be focused on the content of what was being presented, but focused on the ways in which they were going to actually put that into practice. So we've actually done quite a bit of research over the years, and small group learning, especially with a consistent group of learners, is a very powerful way for physicians to learn. Because in order to learn, you have to be willing to acknowledge that you've got some gaps, you've got some outdated knowledge, you've maybe made some mistakes. And if you can acknowledge that in a very safe environment, which is what the small group provides, then the likelihood of you actually onboarding that information and then moving to a new way of looking at that information really increases. We also have the residency program. The residency program is used in almost all of the residency programs across Canada in various ways. The third program we have that people are much less aware of is the individual practice-based learning program. And that program has primarily been used by people that for whatever reason can no longer meet in their group, or if they need to take a year off or they're moving and they don't have a group. But we're now expanding that program and have developed a new interactive module. The FMPE program has been developed by family physicians for family physicians. And so what that means is that from the very beginning of the program to the very end, it's focused on family docs and managed by family docs. I myself am a family physician, and all the people that are directors in the organization are family physicians. We really have created this community of learners so people are comfortable, it's safe, and they're willing to expose challenges, gaps, and even errors. A new physician might want to be a member of the FMPE primarily for that development of that community of learners, that ability to have a group of trusted colleagues that you can work with on a regular basis, and then that can help you benchmark your practice and the way you're practicing against that of other physicians whom you trust and respect. And you know, the medical knowledge changes. They say doubles, triples, it changes all the time every 7 years. And so keeping up with the breadth of knowledge that someone has to for family medicine is truly overwhelming. And so being in a group helps you manage that knowledge explosion a little bit better.